Okay, I'm going to sanitize my hands and introduce myself to the patient. My name is Brianna. I am a nurse practitioner student that's going to be doing your head, eyes, ears, nose, and throat exam today. Could I have your name and date of birth?
Gregory DeMarco, 9/2/86.
Okay, I'm just going to obtain consent. You could sign. Thank you. Okay, so first we're going to inspect his skull and his scalp for size, symmetry, deformities, lumps, lesions, and hair distribution. So I'm going to look around. Everything looks good. Okay. So then we're going to palpate his skull for tenderness, masses, and abnormalities, which I don't see any. He does have a scar in the back. I'm going to palpate his temporal arteries for thickening and stiffness. Feels good. I'm going to palpate his temporal mandibular joint for tenderness, crepitus, and range of motion. If you can just open and close your jaw. Thank you. Okay, next we're going to inspect his external eye structures, his lids, his lashes, his lacrimal apparatus, his conjunctiva and his sclera. Looks white, nice and pink. Everything looks great. Okay, then we're going to assess his visual acuity using the Snellen chart. Just going to have him read the lowest line that he can. I'm going to stand 6 feet away. You can read the lowest line.
LTFPH.
Okay, I'm going to do the visual field confrontation test. I'm going to sit across from the patient about 3 feet. I'm going to have him cover his right eye, and I'm going to cover my eye as well. If you could just focus on this eye and tell me how many fingers I'm holding up.
4, 2, 2, 2.
Okay? And then now I'm going to inspect his pupils for size, symmetry, shape, and reactivity using a pen light. So if you can look directly at me. And they're reactive. They look great in size and shape. I'm going to test his extraocular eye movements for cranial nerves 3, 4, and 6. If you could just follow my pen light, keep your head straight, and just follow my pen light. And I'm looking for nystagmus and strabismus. Okay, next I'm going to do a fundoscopic exam that looks for the red reflex, the optic disc, the vessels, the macula, and the retina. I'm just going to turn my fundoscope on. You can just look straight ahead. Okay, nice red reflex. His vessels look great. Perfect. Okay, I'm going to close that. That's it for the eyes. Next, we're going to look at his ears. So the external structures, the shape, the lumps, the lesions, any discharge, and also alignment. So everything looks good. They're nice and aligned. Some freckles noted. I'm going to palpate the pinna and the trachea for any tenderness. How does that feel?
Good.
And then the mastoid process, the bone behind the ear. Any tenderness or pain? No? Okay. Next, I'm going to get my otoscope and do an exam internal into his ears. Okay, I'm going to turn this on. And I'm going to be looking for canal patency, cerumen, and his tympanic membrane. Some cerumen buildup. Everything looks intact. And check the other side. A little bit more cerumen buildup. Everything looks great. Okay. And then we're going to do test his hearing. So we're going to do the whisper test. I'm going to stand behind you. I'm going to have you cover your right ear. I'm going to whisper in your left ear. If you can just repeat what I say, if you can hear me.
11.
Okay, I'm going to test your other ear. Do the same thing.
12.
Okay. And then if there was any hearing loss, we would do the Rinne test. So I'm going to strike this and I'm going to place it near your ear and let me know when the sound is most loud. Okay.
The beginning.
Okay, and do the other ear.
Beginning.
Okay. No hearing loss. Okay, and that also assesses the vestibulocochlear nerve. Okay, so next we're going to look at the nose. So we're going to be looking for alignment, any swelling, any deformities or lesions, which he does not have. Does have a bone bump from a fracture. And then we're going to assess the nasal patency. So I'm going to have him block one nostril if you can breathe in and out. Same for the other side. Okay. No stuffiness, congestion.
Nope.
Okay, then I'm going to use an otoscope and look in his nose. So I'm going to be looking for the mucosa, the septum, the turbinates. Check for any polyps or discharge. Ooh, okay. Okay, septum looks great. A little bit of discharge. Okay. All right, and then I'm going to assess his sinuses. So his frontal and his maxillary sinus. So do you feel any tenderness? How does that feel?
Good.
Okay, and then I'm going to percuss. No dullness. Okay. All right, so now we're going to assess your throat, your mouth, and your neck. Okay? I'm going to look in your mouth. I'm going to look at his lips, his oral mucosa, his gums, the teeth, his tongue, and the hard and soft palate. If you could just open your mouth. Okay. I'm going to inspect his tonsils and the posterior pharynx. If you could just stick your tongue out. Say ah. So I'm looking at his tonsils, which are 0 to 1. Assessing the cranial nerves 9 and 10 for his uvularized and his gag reflex. If you could just stick your tongue out, say ah one more time. Okay. I'm not going to make him gag. He does have a gag reflex. Okay. Then I'm going to put my gloves on and palpate the tongue. Look under the tongue and palpate the floor of his mouth. Okay, if you could just open up. I'm just going to feel under your mouth for any bumps or tenderness. How does that feel? Okay. All right, then I'm going to look at his neck. I'm going to palpate, look for feel his lymph nodes, and make sure his trachea is nice and midline. Everything looks great. And then I'm going to look at his thyroid gland. Make sure there's no tenderness. Look at the size and any deformities or nodules. Everything looks great. No pain.
No.
Also checking the lymph nodes throughout the neck and the face. Any discomfort?
No.
Okay. You are all set. That concludes the head, ears, eyes, nose, and throat exam.
Thank you, miss.
Oh my gosh.